Have you ever looked closely at someone's eyes, or perhaps even your own in a mirror, and noticed that their pupils are not quite the same size? It can be a little startling to see, and it often leads to a natural question about whether something serious might be going on. Unequal pupils, a condition also known as Anisocoria, can sometimes be a serious eye problem, but not always. The seriousness depends entirely on the underlying cause and whether it is accompanied by other symptoms. While some instances are harmless, others can signal an urgent medical issue. The reason pupils can be unequal stems from how our nervous system controls the muscles that constrict and dilate the pupil. The iris, the colored part of your, contains two sets of muscles that respond to light and other stimuli. One set makes the pupil smaller, and the other makes it larger. When these muscles, or the nerves controlling them, are affected by anything from minor irritation to severe neurological conditions, the pupils can become different sizes. A common and harmless cause is what we call physiologic anisocoria. This means that for about 1 in 5 people, a slight difference in pupil size is completely normal and has been present since childhood. It is usually less than 1 millimeter of difference and does not cause any other symptoms. However, unequal pupils can also arise from more concerning issues like certain eye injuries, inflammation within the eye, medication side effects, or even neurological problems such as a stroke, a tumor, or nerve damage. So, how do you know if your unequal pupils are something to worry about? First, consider if this is a new change or if you have always had slightly different sized pupils. If it is a sudden onset, especially if accompanied by other symptoms, it warrants immediate attention. Look for signs like a drooping eyelid, double vision, headache, eye pain, vision loss, or difficulty moving an eye. If any of these are present, you should seek prompt medical evaluation. To help determine the cause, an eye care professional will typically perform a comprehensive eye exam. They will observe how your pupils react to light and darkness, check your eye movements, and assess your overall eye health. This evaluation helps them identify whether the anisocoria is physiologic, meaning benign, or pathological, which indicates an underlying medical problem that needs addressing. They might also ask about any medications you are taking or recent injuries you have sustained. Understanding the potential reasons behind unequal pupils is important because early detection of a serious underlying condition can be critical for your health. While finding a slight difference in pupil size might initially cause concern, remembering that many cases are benign can ease your mind. However, the presence of new symptoms or a sudden change means it is always best to consult with a care expert to ensure your well-being.